segment of our agenda on mining and community health in tribal communities in the Southwest. I think many of us are familiar with the impact of historic uranium mining, particularly in Navajo Nation and other areas of Arizona and in the surrounding states. So this should be a very interesting session. And I'm going to introduce Dr. Paul Sharp to be our first speaker. Dr. Sharp has been with CDC for over 34 years. He is a subject matter expert in the field of radiation, radiation safety, and health impacts of radiation exposure. He has worked on numerous mining sites in Indian nations and assisted tribes with the evaluation of radiation contamination. So he's also presenting virtually. So Dr. Sharp, I think we're all ready for you.
All right, thank you. I've activated my camera. I'm not too sure. Well, there I am. Hi, everyone. I hope the heat's not too bad in Phoenix. I'm sure it's been miserable. I'm in Atlanta, and although we haven't had air temperatures as hot as you, the humidity has been horrendous, to say the least. What I'd like to do is tell you a little bit about myself first. As mentioned, I've been a health physicist with the Centers for Disease Control and Prevention for about 35 years. In that time, I have worked with the Agency for Toxic Substances and Disease Registry, where I've evaluated a lot of radioactive contamination in the Indian nations, both west of the Mississippi and a few east of the Mississippi. Most of these have been with the Navajo Nation, the Laguna Pueblo, the Spokane Reservation, and some of the other tribes that are located along the northwestern area around the Hanford site. Most of this work has been involved with uranium mining and milling, and the contamination that has been left on site from these activities. So that's a little bit about who I am. Again, I live in Atlanta. I do work at the CDC, and what I do is really evaluate radioactive contamination at Superfund sites and sites that have been requested to be evaluated by ATSDR. What I would like to do is I can either give a presentation on uranium contamination and uranium physical properties and radioactive properties, or I could just talk a little bit about some of the resources that ATSDR has in support of the nations in their battle with environmental contamination from all this uranium processing and uranium mining that has been ongoing in Indian lands for, probably close to 100 years. So either way you'd like for me to go, I'll be easy. I can do. I'll leave it up to the meeting. All right. Well, let me go a little bit about some of the resources and services that CDC and ATSDR can supply. As I mentioned before, CDC and ATSDR work together in the area of public health. ATSDR has the administrative authority. Yes.
Sorry, not to cut you off, but I think we were thinking option B on uranium would be the best way to go.
Oh, okay. Well, then I'm going to share my screen.
Perfect. Thank you.
And we'll go from there. So I'm going to talk a little bit about the chemical properties of uranium. So let me do this. You can see the slides now. This was a presentation that I gave to the Navajo Nation at a uranium roadshow. So I want to talk a little bit about what really uranium is. Uranium is a naturally occurring metal that is also radioactive. It was discovered in 1789, and it was named after the planet Uranus, which had been discovered not too soon before that. It took about 107 years after the discovery of uranium to find out that it was radioactive. So people have been playing around with it and being exposed and not being aware that it was radioactive. From a more chemical point of view, uranium has an atomic number of 92, which means it's the heaviest of the naturally occurring elements. Each of the 92 naturally occurring elements is given a number 1 through 92, with each number being related to a part of its atomic nucleus. In the case of uranium, it has 92 protons. And if you want to compare it to hydrogen, which is the lightest of the elements, hydrogen has 1 proton. So I mentioned that uranium is pretty heavy. It's very dense. It has a density of about 19.1 grams per cubic centimeter, which means that if it were a liquid, even lead would float on uranium. That's how heavy the uranium is. Lead has a density of about 11.3, so it is about 8 grams per cubic centimeter lighter than uranium. Because it is a metal, uranium has a very high melting point. In this case, it melts at about 1100 degrees centigrade, which is probably about 2200 degrees Fahrenheit. And if you continue to heat uranium to over 4000 degrees centigrade, it will start to boil. 4000 degrees centigrade is about 7500 degrees Fahrenheit. As a metal, uranium is not very soluble in water, but if you dissolve it in acid, it can become soluble. And if you dissolve it in some basic materials or things that are like lye or sodium hydroxide, it can become soluble as well. If you ever take a look at uranium as a metal, it's silvery, kind of whitish. You can pull it into very thin strands. You could use a hammer to flatten it out into a sheet. But just remember, anytime you're working with this, it is a radioactive metal, and it does have some hazards associated. If you look at the abundance of uranium in the environment, it's more plentiful than mercury, and it's even more plentiful than silver. And in some areas, it's even more plentiful than gold. Typically in rocks, uranium is present in about 3 grams per kilogram of rock, and that equates to about 7.2 milligrams of uranium throughout the Earth's crust. So here are some pictures of uranium. On the left, we have uranium that's found in rocks. You may notice the yellow in the rocks. Yellow in the rock that's on the left. That yellowish color is a uranium material that's present in the rocks. In the center picture, we have a purified cylinder of uranium. And you can see that it's kind of silvery, kind of white. And on the far right, we have someone holding a flat disk of uranium. You can also see its characteristics. The radiation that's given off by the uranium is stopped by the rubber glove that the person is wearing. So the radiation from purified uranium is not very much. Only when uranium is found in nature is the radioactivity quite high. And that's not because of the uranium, but it's because of whatever else is in the rock that the uranium decayed into. Some of the chemical hazards of uranium include that it could be seen as a powder, or it could be in forms of a chip. This powder or these chips will spontaneously ignite in air and they will burn. So if you find a uranium powder, you need to do something because it will self-ignite and cause a fire. If it's stored in open air, it will self-destruct from a solid to a powder, and then that powder will ignite. So uranium, even if it's formed into a block or a cylinder, over time it will degrade and form a powder. Uranium metal will also react with water at room temperatures, and that reaction will form a uranium oxide and a uranium hydride, and it will swell and disintegrate the metal as well. And also during this property of degradation, the uranium will form a hydrogen gas reacting with the water that's in the air, and the hydrogen gas can be released. Hydrogen gas is flammable and it can also explode. So just having uranium sitting around is very, very dangerous. Some of the other chemical hazards associated with uranium is that it can react violently with fluorine gas. It will react violently with chlorine gas, bromine gas, nitric acids, the selenium metal, sulfurs, ammonia, and several other materials. And each one of these materials will not only become hazardous because it has uranium associated with it, but because of the chemical forms of these gases and metals and organic compounds, they have intrinsic hazards as well. A lot of the uranium compounds are yellow in form, so it kind of, if you see anything that's laying around that's either yellow or greenish in your areas, there's a good chance it may have uranium associated with it. And I'll show you some forms of common uranium that's found in some of the western areas in a few minutes. Some of the toxic health hazards that are associated with uranium include irritation of the skin, which is called dermatitis. If you ingest a lot of uranium, it can lead to renal damage or damage to the kidneys. It will bind to some of the kidney proteins, and it can lead to kidney damage and possibly kidney diseases. It can cause necrosis or damage to the arteries, and rare cases with very extreme exposures where someone may ingest pounds and pounds of uranium, it could possibly lead to death. If you inhale uranium particles, it may cause a long-term problem in your lungs and may lead to lung cancer. If it doesn't cause lung cancer, the uranium dust can be a respiratory irritant. It can cause coughing, shortness of breath, and emphysema and some other lung diseases. The more soluble a uranium compound is, the greater its chance to form soluble compounds that can damage the kidney. the more soluble a uranium compound is, the less soluble it is, the less chance of it being accumulating at the lungs is. So it will leave the lungs, go to the blood system, and concentrate in the kidneys and in the bones. If it has long-term contact with the skin, it may damage the basal skin cells that form the your skin surfaces. So how is uranium found in nature? Well, it's found in a crystalline form. It's never found as a pure uranium metal. These uranium ores have different names. Some of them are called uranite. Some of them are known as pitchblende, carnotite, autunite, urethane, and turbinerite, and I have pictures of these. You can also find it in fertilizers, in phosphate rocks, lignite, and in monazite sands, which usually have a lot of uranium. A lot of times the monazite sands are called black sands. So what do some of these ores look like? Here is a picture of autunite. This came from the Reese River District in Nevada, from the Apex mine. Notice it looks like a semi-transparent green crystal. So if you see any of these laying around, there's a good chance it is radioactive from the uranium that's bound to the other materials in the crystal. This is a picture of carnotite or from the Monument Valley area of the Navajo Nation in Arizona. Notice on the right-hand side, the uranium is kind of orange, and also mixed in is a little bit of pitchblende, which is kind of yellow. And then the orange is well seen on the left-hand side. Here's the picture of turbernite, which is also from the Grants Mineral District in New Mexico. Here you see a little bit of yellow, or excuse me, green mixed in with the rock. This is a good indication that it is uranium. So if you see this laying around, again, it'd be prudent to turn around and get away from it. Not because of the uranium, but because of the other radiation that's given off by the materials in the ore. This uranium is uranite. It's from the Homestake mine in the San Juan County area of Utah. In this case, we're concerned about the black area, the black being the uranium material. Again, this is radioactive, but because it is naturally occurring, not only does it have uranium in the ore, but it also has radium, thorium, and several other radioactive materials, and it also emits radon as a radioactive gas. So this is why these ores are hazardous, not only because of the uranium, but it also because they emit radon. They also contain thorium, radium, and other radioactive materials, and all these other materials are what gives it the radioactive hazard. One thing that I didn't mention is that because of these radioactive salts are soluble, you may actually find petrified wood in some of these mining areas that are petrified with the uranium salts. And these petrified wood pieces can be very, very radioactive. So if you ever go into someone's home and you find petrified wood and you ask them where they got it from, and if they got it from a mining area, they should have that wood tested because it may be hazardous, radioactive, and does not need to be inside their houses. Here's another form of uranium ore. This is uranophan. This came from the Poison Canyon area, the Grants Mining District, just north of Grants, New Mexico, and not too far from San Mateo, New Mexico. This is Cibola County. You can see the uranium ore, in this case, looks like a starburst. And each one of these greenish yellow strands is a uranium material. So these needles are about 2 centimeters long, and there's a lot of smaller crystals in this matrix. And all this is part of the uranium ore. And so you can have small flakes of this coming off, getting on animals, your shoes, your clothes. So any of these materials can be very highly radioactive and toxic. So I've mentioned a little bit about radioactivity, and I know a lot of people say understand or recognize the term, but they may not recognize what it really means. Essentially, radioactivity is the process that certain elements give off energy. And these elements are considered unstable in that they have an imbalance of subatomic particles in their nucleus. And because these subatomic particles are unbalanced, they have to undergo some process to become more balanced or more stable. And this process of undergoing the removal of some of these unstable processes is radioactive decay. There are thousands of naturally occurring and man-made radioactive elements, and each one of these is called a radioisotope. But in nature, there's only about 5 or 6 elements that are naturally occurring and radioactive. And these start with element number 94 and go up to element number 92, which is uranium. You'll also find radium is atomic number, I think, of 83 or 84 is radioactive. But everything above, like I said, actually everything above atomic number 93 is radioactive. So there's about 10. Every time an atom undergoes this radioactive decay, it forms a new atom. And that new atom that's formed is also radioactive. So when the uranium decays, it forms about 15 different radioactive substances. And sooner or later, the uranium will decay into a stable form of lead. So radioactive decay is a physical process. It cannot be stopped by freezing, by heating, by anything that's commonly known to man. It will go on even if the material is at absolute zero. These are some of the products that uranium decays into. Uranium-238, which is the most common form of uranium, has a 4.47 billion with a B years of half-life, and it undergoes these different elemental decays before it gets down to lead-206, which is stable. So you can see that it decays into uranium-234, which has a 245,000-year half-life. Decays into thorium-230, which has about an 8,000-year half-life. Radium with a 1,600-year half-life. It decays into radon-222, which has a 3.8-day half-life, and so on. Now, one thing is that because uranium is always decaying, in nature, the presence of each one of these items, each one of these isotopes on this chart are going to be present in the ore. So even if you got rid of the uranium-238, you would still have all these other uranium byproducts in the ore. So this is why the ore is always going to be a hazard. It's always going to be producing all these different radioactive products, and each one of these radioactive products contributes to the radioactivity of the ore, not just the uranium. So you've got about 15, 16 other radioactive products that are making the ore more radioactive than the uranium itself. So I've used the term half-life. And half-life is a simple term that, that says that this is the amount of time it takes 1/2 of the amount of atoms to decay away. So half-lives in nature range anywhere from 1/millionth of a second to billions of years. So for example, if you have something that has, let's say you have 100 atoms of uranium that decay away in 1,000 years. After one half-life, or 1,000 years, that 1,000 atoms you have is now down to 500 atoms. After another 1,000 years, you're down to 250 atoms. After another 1,000 years or 3,000 years, you're down to 125 atoms, and so on. So over a period of 9 or 10 half-lives, it will take that long for some of these atoms to decay away to nothing. Now, when you have atoms that have, or elements that have very, very, very large numbers of atoms, it will take billions and billions of years for those atoms to decay away. And that's one reason why we still have uranium-238 on the planet. Its half-life is about the same amount of time the Earth has been in existence, about 4.5 billion years. So uranium is radioactive. There are 3 chemically identical forms of uranium that are found in nature. Chemically, they behave the same, but their radioactive properties are different. The 3 isotopes, starting from the bottom, are uranium-238, that's present in 99.3% of all the uranium that's found in nature. Isotope uranium-235 is present at about 0.7%. And the uranium-235 is what is used to power nuclear reactors and what was also used in the atomic bomb that was dropped on Hiroshima. The remaining uranium isotope is uranium-234, and that's present in about less than 0.01% of all the uranium that's found in nature. You can see the half-lives range from about 4.5 billion years for the uranium-238 and about 245,000 years for uranium-235. No, excuse me, 238-4. All of these are alpha-emitting decays, which means they emit a helium nucleus when they decay, and they all decay into forms of thorium, and each one of these thorium atoms is radioactive. So I mentioned radioactive decay, and there are 3 types of radioactive decay. There are alpha decay, beta decay, and gamma decay. Alpha and beta decay are particles. Gamma decay is pure energy. It's essentially another form of visible light. When an atom undergoes an alpha decay or a beta decay, a new isotope or a new atom is formed. That atom does or does not have to be radioactive. It just depends on what the atom that is formed is. If an atom undergoes a gamma decay, there is no change in the atom. All the atom has done is gotten rid of a little bit of energy. Each one of these types of decay have different types of hazards to plants, animals, and humans. So here's a generic graph of an alpha particle. Here we have a uranium nucleus that's undergoing an alpha particle decay. That alpha particle can be stopped by a sheet of paper, a piece of skin, clothing, a blade of grass. It will not travel more than a few centimeters in air. But if you ingest it or inhale it, that alpha particle is very, very dangerous to plants or animals and people. A beta particle, if it's ejected from a nucleus, is very, very small. It's the same size as an electron. It weighs about 2,000 times less than an alpha particle, but it can still be stopped by materials such as plastic and glass and light metals such as aluminum. Gamma rays or gamma radiation, again, are emitted by the nucleus. It doesn't have to be emitted with a beta particle. It doesn't have to be emitted with an alpha particle. It could be emitted by itself. If it's emitted by itself, there's no change to the parent nucleus, but the gamma rays are given off. And in order to stop gamma rays, you need very dense materials such as lead, concrete, or earth. Soils make a very good shield for gamma rays. So in summary, the shielding for radiation is shown on this visual. Alpha radiation can easily be stopped by your hands. Beta radiation can be easily stopped by aluminum or plastics. Gamma radiation can be stopped by lead. And then neutrons, you don't have to worry about neutrons. They're not a type of radioactive decay that you'll be finding in nature. So when you read about uranium, you'll see the word processed uranium or enriched uranium or depleted uranium. So what does all this mean? They all mean different things. When you're talking about enriched uranium or depleted uranium, what you're referring to is the amount of uranium-235 that is present in that uranium. Now remember, if you pull up uranium ore from the ground and isolate the uranium from all the other rock, that uranium will contain about 0.72% uranium-235 in the ore. Now, since the uranium-235 is what the nuclear industry wants, everything else is considered waste. So that means the U-238 is waste, the uranium-234 is waste. So what they try to do is enrich the uranium and the amount of U-235. So when they talk about enriched uranium, that means the uranium contains more than 0.72% of uranium-235. And in order to do that, it takes special processing. Because remember, all these uraniums behave the same chemically. So if you try to chemically separate uranium-235 from uranium-238, you cannot do it. It just doesn't work. So they do special processing, such as using lasers. They use centrifuges. They used to use gaseous diffusion to enrich the amount of U-235 in the ore. So when you enrich the U-235, what's left is called, the waste product is called depleted uranium. And by definition, depleted uranium has less than 0.3% uranium-235 by definition, essentially by weight. So enriched uranium will be found at, again, in nuclear reactors. It'll be found in weapons. It will not be found at uranium mines. It will not be found in nature because it's just too expensive to throw away. Depleted uranium will not be found in mines, but they used to use it for a lot of things, such as counterbalances in elevators, counterbalances in airplanes. They used to use it to add weight to Scotch tape dispensers. They used to use it in a lot of things. They even use it to shield for gamma rays because it is an excellent shielding material for gamma rays because it is so dense. But again, depleted uranium is not found in the environment. It's not there. So why was all this uranium dug up and what happened to it? Well, the ore was extracted from the mines. It was, in the early days, sorted by hand. The miners would have a Geiger counter or some other type of radiation detector. They would get the ore, they would measure to see how radioactive it was. If it was radioactive enough, it went into one pile. If it was not radioactive enough, it was thrown in another pile as waste pile. The ore that was radioactive enough was taken to a uranium mill, and these uranium mills were, pretty close to the mines. There was one in Blue Water, New Mexico. There was one near the Ute Mountain Apache tribe in White Mesa. There were one in Blanding, Utah. Tuba City had mills. But all this ore was taken to the mill, it was crushed, and then it was chemically treated to dissolve away the uranium and get rid of all the other waste products. So when they chemically treated the crushed ore, that resulted in two streams. One stream was the uranium, which they kept. The other stream was a waste product, and that waste product was more radioactive than the uranium that they extracted. The reason, again, why it was more radioactive is that it had all those other decay products, the thorium, the radium, radioactive lead, different forms. You go back and look at that chart, 18 different types of radioactive material in it, and all that was adding to the radioactivity. So the waste products were very, very radioactive. After the ore was extracted at the mills would process the uranium metal to form a salt, either called yellow cake or green salt. And here you see pictures of yellow cake in the upper top. Yellow cake is the uranium oxide. It's got the chemical formula of 3 atoms of uranium with 8 atoms of oxygen, U3O8. Or green salt is the uranium fluoride with 1 atom of uranium with 4 atoms of fluoride. So the yellow cake or green salt was shipped away to be further processed. But all the uranium waste products were stored at the mill because it wasn't worth anything. So it was just waste. They just throw it away in a pile. And those piles would get larger and larger and larger. They would become more radioactive. And anytime the wind blew, a lot of this radioactive dirt or waste would blow around, and it would contaminate large areas around these uranium mills and mines. A lot of this uranium waste was sandy, and that's why it blew around a lot. Some people took that sand and used it for building materials. So if there is a uranium mine or a uranium mill in your areas, they should be given wide berth. Don't go anywhere near them. They should be fenced off and should keep people off these mines and mill areas. So how much mine waste is there? Nobody really knows. The U.S. Geological Survey thinks there was about 4,000 open pit and underground mines in their database. That includes hundreds of mines, if not thousands of mines in Indian lands. And all these mines generated about 3.3 billion tons of mine waste. And all these mine wastes are represented about tens of thousands of cubic yards of waste material just sitting out in the open environment. So some of the hazards associated with these wastes are that they're radioactive. They can be soluble in water, and they contain a lot of other radioactive metals, non-radioactive metals such as arsenic and lead, and there's a lot of physical hazards. So I think I've taken up a lot of time. I think what I will do is end here and open it up for any questions.
Yeah, Dr. Sharp, could you also talk about the resources that you mentioned earlier?
Sure. ATSGR has environmental health scientists and toxicologists that can assess the non-radioactive impacts of all these mine sites. They will look at the arsenic, the lead, other heavy metals, mercury, molybdenum, and so on, that may come off of these mining and milling sites. However, to evaluate the radioactive parts takes a specially qualified person called a health physicist. ATSGR currently has 3 health physicists on staff. CDC currently has 3 health physicists on staff, but they're trying to hire 3 or 4 more. These health physicists can evaluate the radiation hazards, evaluate the radiation dose, and determine what the adverse health effects might be from someone who's inhaled or ingested these radioactive particles. And they can even tell you, once they review the data, how far someone should be from these piles to be safe. Let me give you an example of this. I'm one of the health physicists. I work both with NCEH and ATSGR. In September of 2022, I was out in the Grants Mineral Belt up near San Mateo and the Ambrosia Lake area. And there are several uranium mines. That's around the Poison Canyon area, if you're familiar with that. I was up around the Ambrosia Lake area, and we were driving up a road toward one of the old mill sites. And I had a radiation meter with me in the car. It was turned on. And all of a sudden, while we were driving, the radiation meter went past its maximum reading. And at that point, as the only radiation expert in the vehicle, I said, okay, we stop here, we turn around and we go back. And we were probably I would say a good half mile or more away from the uranium pile. So with expertise like that, we can tell without even analyzing the material, we could just measure the radiation and tell you, go away, get so many feet back, so many miles back from the piles. So that's some of the resources. Many of you may know Jamie Raymond out of ATSDR's office in San Francisco. She is a public health educator. She's worked extensively with, mostly with the Navajo Nation, but she has been well-versed on some of the effects of uranium and uranium mining. She'll be willing to work with your tribal health officers, tribal education folks. She knows who to reach back to in Atlanta for assistance. And I believe she's also worked with Indian Health Services. And she can give you all types of health education and educational materials to help keep your tribal members and other people in the area safe from all these exposures. I think that's it in about a nutshell. Does that help answer your question?
It does, absolutely. This is Shay. Nice to see you, Doctor. Thank you so much for your both presentations about what is radioactive. I had no idea it was so heavy, and that if it were a liquid, that lead would actually float on that. That was very interesting. A number of those items, of course, went way over my head because my field is policy, but I did appreciate, and it perks my interest in so many different ways, particularly that it is a naturally occurring substance. But yet it is radioactive. I wonder how we in the environmental field may overlay where we have topography or other kinds of maps where we can see high radioactivity in the ground as a naturally occurring substance and overlay it with cancer and cancer clusters. So that perked my interest. I wanted to let you know, thank you for that. Regarding the resources, is there a particular way that Indian country tribes, tribal serving organizations can reach ATSDR or CDC in order to request some of the technical assistance that may be available? How do we do that, sir? And thank you again for your presentation.
Well, thank you. Let me go back to your first question before I give you the resources, phone numbers and things. You say you're a piqued interest of overlaying cancer rates with radioactivity in the ground. I've never seen that. However, the U.S. Geological Survey many, many years ago developed maps of where the radioactivity was in the U.S. And those maps are available. They're online. And if you send me your email address, I will be glad to send you the link where you can look at those maps. And then if you know people who have the correct wizardry to overlay cancer rates, I don't know what that would show, but it would be interesting. You could overlay through a geographical information system to see what that looks like.
Yeah, thank you for that. I think that CDC has a cancer program in Albuquerque. We have several staff. I'm from CDC. My name is Shay. I am the acting director of the Office of Tribal Affairs and Strategic Alliances, which you may be somewhat familiar with.
Yeah, I used to work with Annabelle.
Well, there you go. So you know Annabelle. Annabelle
Yes.
works in the cancer division there in Albuquerque. If I may be so bold to ask you, sir, to work with Annabelle and Melissa Jim, her colleague there, and maybe we could do such GIS overlaying. It would be very interesting, particularly as we have the cancer moonshot. And CDC is involved with that, and we will have a report to the White House on our efforts. And certainly I think that a number of tribes during the all summer long HHS tribal consultation meetings have brought up their concerns about the higher rates of cancer they have been seeing. So I think that it's worth the effort, and I'm happy to help Annabelle or Melissa Jim, again, who works with Annabelle, who you know. So again, thank you. Let me look around the room and see if there are other questions. Oh, yep, got a couple questions. Oh, 1, 2, 3, 4, 5 questions for you, sir. Here we go.
I still need to give you the contact information, so let's not forget about that.
Hello, good afternoon. My name is Marcia. I am from the Navajo Nation. I actually had a question for you. I know that you covered uranium extensively. I was wondering if there was anything else on your radar, particularly coal mining, black lungs. Is that something that's on the radar of the CDC or NCEH in any regards?
That I don't know. Usually black lung, I think, was more under the purview of a worker health and safety, and that would be under the National Institute for Occupational Safety and Health Administration, NIOSH. So I don't know. I really can't answer that.
Thank you. This is Donata from NCH ATSTR. It's not a question for you, Dr. Sharp, but I do wanted to mention that we have recently released, well, maybe close to a year ago, examining the unusual patterns of cancer guidelines. And so we're working with, and we'll get a slide up for everyone to see later on today. We're working with ASTO, and we're looking to get input from various tribal members on the guidelines. So if you are interested, or you know others who may be interested, we'll put the slide up with ASTO's information and the contact person. So I will hand the mic over to whoever is next on the list for questions.
And while we're doing my moving around the room, sir, with the microphone, maybe you could put the contact information up on your slide. Thank you.
All right.
So this is Laurel Berman. I work for ATSDR, and your regional offices are 6 and 9. 9 particularly works in this region. You'll find our quirky little science brains do all kinds of, some of us know about coal mining, pneumoconiosis, just from the type of work we've done in the past. So your regional staff are a really good place to start, and Google's a really great way to just get to the ATSDR map for your region. Jamie Raymond, certainly Region 9, and done a lot of work on health education related to uranium, but also general environmental health education.
Thank you, Laurel. Region 6 is our Dallas office. And so Region 6 does a lot of work in New Mexico, and in the Oklahoma areas. Region 9 covers the Southwest, Arizona, and Nevada. Utah, I believe, is out of our, actually, is Utah in Region 7? Yes, Utah, the tribal nations in Utah would contact folks in our Denver office. All right, now I've also put the name of their contact in our San Francisco office, who's worked with the Navajo Nation, Jamie Raymond. Her email address is fpe7@cdc.gov. And if you cannot get in touch with Jamie, you can always call 1-800-CDC-INFO and just tell them that you would like to talk to Jamie, or a message to Jamie, and they can get it to you. You can also ask for, you can ask for me. Let me put my contact information up. All right, let me see if I can get Jamie's back into a regular color again. No. So mine is PAC4@cdc.gov.
Thank you so much, Dr. Sharp. I think everyone is writing down your email address, and as well as Jamie's. Are there any other questions?
Shay, let me add one thing. You said a lot of this was over your head. It is a very difficult topic to discuss, and if you want a more detailed yet generic presentation or discussion of some of these concepts, we'll be glad to give it for you.
Thank you so much, Dr. Sharp. We appreciate that offer. Right. Are there any other last minute questions before we transition on? All right, thank you so much, Dr. Sharp. I appreciate it.
Thank you so much.
Kindly, bye. Bye, Dr. Sharp.
Hi, Dr. Sharp.
Bye.
Hello.
Hi, I'm still here. If you have any other questions, just yell.
Nope, we're done. We're done. Dr. Sharp, thank you so much. We're moving on to our next presentation. Thank you kindly, sir.
You're welcome.
Hello, I'm Denise Bartley. I am a nurse practitioner with Northern Navajo Medical Center. I work for Indian Health Services. I've been there for over 20 years. I do apologize. We have slides, but we're not able to access them. So I'm going to start. We've been working for the last 40 minutes to get them over here, but I'm going to go ahead and start. And I apologize because it was somewhat of a visual presentation, but hopefully we can get those slides sent out to you at a later date than maybe. So before I start with really talking about the programs that we have through IHS, I just wanted to do a little bit of history on the uranium industry in the Cold War era. So uranium, what happened was the federal government decided that they needed uranium. So they encouraged companies, individuals to mine uranium, and then they would be the sole purchaser of this uranium. So they needed it to stockpile for atomic weapons. So the majority of the uranium that was mined in the western portion of the United States. Now, of these, with just a few exceptions, the biggest producer, or I guess the state that had the most uranium mines, was Colorado, followed by Utah, Arizona, and then it went up to Wyoming and then back down to New Mexico. But the whole western region had some mines and some production of uranium. Even though New Mexico had the fewest number of mines of these top 5 producers, it produced by far more uranium ore than any of the others. Also of note is 75% of these mines were on federal or tribal lands. So between the 1940s and then the last mine that closed at Sanasti on the Navajo Nation was in 1981. Over 30 million tons of uranium ore was extracted from Navajo lands. There was over 500 uranium mines. There's 4 mill sites, and we still have 5 disposal cells. We don't know exactly how many uranium miners we had or uranium workers we had, and the number varies between 3,000 and 5,000. But there's a couple reasons that we don't have this information. So one of them is because some of the mines were very small mines. They're what we call mom and pop mines, and they were ran and mined by individual families. We don't know how many men and women worked in those mines. The other thing is that some of the mining companies paid workers like under the table. They paid them cash or they paid them in product. So there were times when actually people would get a bucket of uranium ore or a truckload of uranium ore. They would take it to the trading post. There would be a gentleman there with a Geiger counter. He would see how rich that uranium was, and they'd be paid accordingly. I have a picture of that. It's really interesting, but I'm sorry we weren't able to get to it today. So beyond mining, the exposure that continued once the mines were closed has been a source of chronic low dose exposure to radiation and heavy metals, which were discussed just a little bit ago. So these continue to have an impact and leave a footprint on the Navajo communities. So these contaminants, the biggest part of spread is from the wind. So the wind will pick up heavy metals and radiation and will disperse it over hundreds of miles. Heavier metals will drop out sooner, but these mines are all across the Navajo Nation. So it's not hit and miss, it's just hit, unfortunately. These particles, they get into our water supplies. We feed our livestock drinks the water. We water our grazing lands with this water, and we water our farms with it. So it's just a cycle that keeps going about this exposure. There's really, I don't know if anybody's seen the dust storms that we have on Navajo Nation or in that Four Corners area, but there's no escaping that dust. So we even encourage beyond COVID that if you're in one of those dust storms, or if you're dusting your house after one of them, that you still go ahead and wear a mask to do that. So we have over 521 abandoned uranium mines on the Navajo Nation. So when the federal government said, we're done buying uranium, we don't need any more, the uranium companies basically picked up and left. And they left the mines as they were, so they're open. So that's how uranium, as well as other heavy metals, get picked up and transported. And also radiation. There was a study that was done. It was an older study, but it was done by the EPA. And what it did is it tested mines for how much gamma radiation that mine was releasing, and they would compare it to the background. So there is normally a background set of radiation that we're all used to. This room has radiation in it. We all are a little bit radioactive. These lights are releasing radioactivity. So that is considered the background. So 44% of these mines that they tested out of this 521 had greater than 10 times the amount of gamma radiation that was being released compared to the background. Now, I don't know how much greater, but greater than 10 times. And then 34% had greater than 2 up to 10 times. So when we're looking at going to the programs that we do, we have two main programs with Northern Navajo Medical Center. And when we were looking at the people that we try to fit into these programs and how they meet the needs of the community members, we've broken into actually three categories. So the first one is uranium workers that worked prior to 1971. Now, those workers are compensatable under the RECA Act because there was not safety standards in place during that time. And then we have the post-71 workers. Some of them were still miners, underground miners, but they are not compensatable under RECA. And then we have non-occupational, which are the community members. Now, if you think about this for a minute, we have the miners and then we have community members, but our miners were community members. So that kind of exposure just keeps overlapping. So the first program I want to talk about is RECEP. So that's the program that we have for uranium workers. This program was established, RECEP was established in 2000. It's with a HRSA grant, and its goal is to provide outreach, education, prevention, and early detection of the cancers, diseases caused by radiation exposure from nuclear weapons testing and uranium industry. So even though that's really the main goal of it, I think a little bit of that goal has been lost, that objective has been lost with the RECA compensation. We also help people with RECA compensation. Definitely they are due that, but I'm a healthcare provider. So my bottom line is like, if we can do the best we can do to get the best health outcomes that we can get. There are 8 RECEP programs in our area: Arizona, Colorado, Nevada, New Mexico, and Utah. There are 3 RECEP programs on the Navajo Nation. That's in Monticello, Shiprock, and Tuba City. There's one right across the border also in Flagstaff, Arizona. Now, our RECEP program is partially funded with the HRSA grant. We screen pre and post 71 uranium workers. Again, that just goes back to these people deserve to have screening regardless of when they worked in the uranium industry. Every individual gets a ABG, a spirometry, and we do a chest x-ray on them. Excuse me. We also do renal panels on those who worked in the mill sites or were uranium ore transporters. We've helped people, we filed over 900 claims on people's behalf for RECA compensation, and we have screened approximately 4,000 uranium workers. So and then we have our community program, and our community program is called QJUT, Community Uranium Education and Journey to Healing. And when we look at how uranium is spread to the community members, as was previously discussed, we need to remember that uranium is a naturally occurring substance in our environment. It was buried, it got brought to life really with the mining, the milling, and the atomic bomb testing. And then we also have the aftermath with the abandoned uranium mines, tailing piles, and the leach ponds. Now, Congress recognized that the community was at risk. And so in 2008, Congress mandated 5 federal agencies to make a 5-year plan to address the community exposure. It also what it ended up doing also is making these 5 federal agencies work together so we can have more breadth in the goals that we had. So the first 5 years went by, we accomplished some things, but not enough. So then we went to a second 5-year, and now we're on a 10-year plan. So things are being accomplished. We've got more partners in with this, more than 5. I think we're down to 12 now. So things are still going, but unfortunately, it's still a slow process. The QJUT program, though, was one of the things that came out of the first 5-year plan. So in 2008, the QJUT program was established at Northern Navajo Medical Center through Navajo Area IHS, and it focuses on community members. So we will screen any community member who has a concern, about their exposure to radiation and the heavy metals. And the exams that we do with them are different from the exams that we do with the RECEP, with the uranium workers. So the uranium workers, we really focus more on the lungs and the kidneys. We know that uranium as a heavy metal gets ingested into the body or breathed into the body, it causes inflammation, and the inflammation is what causes some other ailments. So we're seeing a higher percentage of hypertension, diabetes, and arthritis with some community members that are living near these abandoned uranium mines. We will screen anybody for this clinic. It doesn't matter as long as they have our own Navajo Nation. And we pay special attention to the solid organs because we know that uranium accumulates, as well as the other heavy metals, accumulates in the solid organs, the bones, the kidneys, the liver, and the thyroid. So these are things that we screen. And then I also obtain a chest X-ray, because many of the people that we see in this clinic were spouses or children of uranium miners. And so they would wash their clothes, which would be covered with uranium dust. And so they would actually breathe in some of that. So I always just like to double check that chest X-ray as well. We kind of go back and forth here. So pre-COVID, we were doing a lot more of these screenings in the communities. The downfall to that was that we couldn't do the detailed exams that we're doing now. Post-COVID, or during COVID and post-COVID, we actually brought the screenings into the medical center. And so we're able to provide, yay, there's my slides. We're also able to provide a more in-depth screening, but we're not, again, able to get as many people. Okay, so I'm just gonna do what? Okay. Okay, Janelle, hold on, I'll tell you when to go forward, okay? I apologize. I'm going to go through these first ones really quickly since we've kind of already discussed them. But there's a uranium belt that goes through the western portion of the United States, and it goes smack dab through the middle of the Four Corners area. Again, New Mexico produced more uranium ore than any other state. Go ahead, Janaya. Go ahead, Janaya. This is of the Navajo Nation. So one thing that Dr. Welch discussed earlier was how hard you can get information from the states, but it was more difficult to get information from the tribes themselves. So the Navajo Nation is in 3 states. So it is even more complicated to try to get information. But these are where the uranium mines are. And then we've got the 4 milling sites and 5 disposal sites. Go ahead. These are the difference between the mines. So the first one you see is Church Rock. So there was no way to go through this and not know that there was a mine there. There was something going on there. People knew that. But then this other slide is Ruby, and it's an example of one of the small mom and pop mines. So in the second mine, we honestly don't know how many of these little mom and pop mines there were, but we don't know how many workers there were. Go ahead, Janaya. And this is beyond mining. Mining left, but it still left a scar on the Navajo Nation. And the people are still being exposed to the low dose radiation and heavy metal exposure. These top 2 pictures, these are actually the same place. This is Church Rock. This little boy is watching as they're cleaning up. So they're starting to clean up after to get some of the contaminated soil out. And this, the proportions are a little bit different, but you can still see some of the houses that were right in the middle of this mining area. And one of the things also that I forgot to mention is that the people on the Navajo Nation did not move to the mining sites. The mines went in right next to communities. So this is a good example of that. The bottom is one of the tailing piles. This is at Shiprock. And that tailing pile is 1.7 million tons of tailings. It covers about 77 acres. There's talks right now about the pond, the liner in that catchment pond as at end of life. And so they're trying to come up ways to replace it or to get rid of it. Okay, Janaya. This is the wind, how it picks up the heavy metals and uranium and spreads them, and just how they contaminate the soil, the air, the water. Go ahead, Janaya. This next one is what some of the storms look like on the Navajo Nation. There is no way to get rid of this dust. You can't avoid it. You can lock up your houses and it's still there. Go ahead. Okay, this is the map of the abandoned uranium mines that are in the area. And again, I'm sorry, this is a bit of an older, I have a thing right there. It's an older map, but it's still the best one that we have. And it shows that the uranium and the heavy metals are still being, or the uranium, the radiation is still being released from these mines, even though the mines are not being worked right now. The next section is the crossover that we see between the uranium workers and the community. And you can't really take the uranium workers out of the community. So, and in many cases, the community were so close with those uranium workers that they were almost there. So it's really difficult when they try to spread out this illness is from this and this illness is only for those people. So there's a big crossover there. Oh, go ahead, Janaya. This is the RECEP. So again, RECEP was established in 2000. It was established in response to RECA, which is to assist people in getting the compensation. Go ahead. And I think the rest of that I discussed okay. So this is our RECEP, Northern Navajo. And again, we've worked with over 4,000 uranium workers, both men and women. Go ahead. So some of the illnesses that are covered with RECA for uranium workers, for the miners themselves, as I said earlier, were really addressed to the lungs. They will cover lung cancer, silicosis, pneumoconiosis, pulmonary fibrosis. Some of the things that we're seeing an increase or a trend in which are not covered are COPD in a non-smoking community. And again, the hypertension, the cardiovascular disease, and the diabetes. Go ahead, Janaya. This is one of the reasons that we get really concerned about the pre-71 uranium workers and their lungs. Look how close these men are to that uranium ore, like inches to feet. And then they're just surrounded by it. I'd be a little claustrophobic in there, but this is what they did all day long. Go ahead, Janaya. All right, these are just the forms that community, or the ways that community get exposed to uranium. It's naturally occurring. We have the mining, the milling, and the atomic testing, and then the aftermath. Go ahead. And this is the first part of the 5-year plan that Congress did. So initially it was the 5 federal agencies, but now at our 10-year plan, we have all these other partners in with us, which is great. Go ahead, Janaya. And the focus on this is for the community. Go ahead, Janaya. So the communities, these are chapter houses. These chapter houses are where we used to try to hold all of the community screening events. The chapter houses are the heart of the Navajo communities. We use a questionnaire that was developed and approved. It was developed by UNM and it was approved by the Navajo Nation and the Navajo Nation IRB and IHS. Go ahead. So I reviewed 1,138 of these questionnaires that we had. 52% of them were from women, 48% were from men, and then 30% were from people who had previously worked in the uranium industry. Go ahead. We asked questions on there about past and current exposures. So if you look on this, you can see we asked about their past exposure to contaminated water sources, to food sources, to plant sources, which are used for teas and herbs and medicine, and then structures. I think most of the structures that had contaminated products have been torn down, but a lot of the uranium ore gravel was used as a foundation. And also some of the wood products were used. So those facilities were torn down, but people did use those as their homes when they built their homes. And then finally with that, we're looking at how many people lived within 2 miles of an abandoned uranium mine. So that was the one that really has not changed over time. There are still almost the same number of people that live near an abandoned uranium mine now as they did in the past. Go ahead, Janella. We also ask about whether other exposures, such as, did you live with a person who worked in the uranium industry? Because we're now looking at the second, even the third generation, now we ask if they played in the near the uranium or on the uranium piles, drank or waded in the water, if they herded livestock near the uranium mine, sheltered livestock, or lived in the mining camp. Go ahead. This is the result for those. It's split almost 50%, between 50% of the people who lived with a uranium worker and 50% of the people who filled out this survey played on or near uranium tailing piles or the mine. Go ahead, Janaria. We also asked a health history. Go ahead. And the results of that, this is self-report only, but the top 3, hypertension, diabetes, and arthritis, those are the same things that we have seen. There's a group that's a metals group out of UNM, and they've done some studies on the health of people who live near uranium mines. These top 3 are the same things that they have come up with. And also arthritis is up there. Autoimmune disorders is also up there. But I think sometimes it's a little confusing because people don't recognize that some of the arthritises are actually autoimmune disorders. So we think that one goes kind of hand in hand. And then depression and respiratory. Anytime you get some chronic illnesses in there, you tend to have a higher incidence of depression, but we're also dealing with trauma and historical trauma that keeps going. Okay, Janaya. Okay, and then these are the cancers that we're seeing on the Navajo Nation. So the most commonly diagnosed are breast cancer, colorectal cancer, prostate cancer, and then kidney cancer. But the leading cause of death is colorectal, stomach, pancreas, and then the female breast. So we're catching the cancers later is why we think that we're having a higher incidence of mortality from these cancers. Navajo people have a higher mortality rate from cancer than the other populations. Go ahead. So I have had in clinic, I have had uranium miners, these elder gentlemen, they tell me the stories of them working in the mine next to their fathers, their brothers, their uncles, their cousin brothers. And it's almost like survivor guilt. They ask me why they're the only one left out of all these family members or people they knew. And they want an answer to why that is. And it breaks my heart because I can't give them an answer. But we do know that where people begin at baseline does make a difference. So some people are healthier, their body was able to fight it off better. There's some studies now that zinc may actually fight with the receptors of the heavy metals. And so some people may naturally have had more zinc. But we do encourage everybody to just generally take care of themselves, just like we would in everything else. Get your physical activity, don't smoke. Traditionally, the Navajo people have not been smokers, changing a little bit with vaping, but hopefully we'll get that under control. Drink regulated water sources, which is also much better right now, but it's not complete. There's still many people out there that do not have a regulated water source. Manage your weight, blood pressure, diabetes, practice good hygiene, especially important, good hand washing. Get regular medical checkups. Be sure and get your cancer screenings. One of the things that we do have problems with is we can tell people to get their cancer screenings, but then when we talk about the screening for colorectal cancer, it's pretty invasive. And so we get a lot of people who are dropping off and not actually getting that done. So even though it's invasive, get it done. We can do much more if we can catch something early than late. There's testing for radon. You can get the kits with the Navajo Nation EPA. And then it's also very important to stay connected with your culture, your people, and your community. Maintain that balance of social. Go ahead, Jamelia. And that completes my presentation. And I apologize again for the mix-up in the slides.
Are there any questions?
Thank you.
Sorry,
Thank you so much,
I always
Julia.
grab the mic first. Thank you very much. And I can hear the emotion in your voice, so I want to recognize that because this is a difficult topic. And it's the people that you know, it's the people you care about. It's people that we will never see the faces of or never know their names. So I want to recognize that. And that is trauma unto itself. So thank you for your dedication and your work.
Thank you.
I also understand that there's, for many of us in Indian country, for our leaders who are either involved in the decision, not so much, but when they are involved with the decision on bringing jobs, whether it's mining or etc., that there is a fine balance to that.
Yes.
But and that's hard. That's very hard. And then, if it's BLM on our behalf, because special trust responsibility and they manage our lands oftentimes in terms of grazing or mining or whatever, that we still always have that comment period, right? Not that sometimes it's influential, sometimes less influential, but I just wanted to point out that this happens to Indigenous peoples around the globe, around Mother Earth, around Turtle Island, that we are stripping our resources from the land that we are tied to for economic reasons. Those economic reasons, in theory, would help us lead to better health because we could buy better food and etc. But as your presentation explained, that you're irrigating your own, you are what we eat.
Yes.
So whether it's Roundup or any other pesticide, or what we have in our waters, in what we are using to keep our plants alive, to feed us for that cycle. And again, that balance between bringing jobs and the whole, if there is a company or some sort of work around a tribe, that the tribe has preference in hiring and all of those rules and regulations, back to this is very complex, our world. But I really wanted to thank you for your dedication, recognize the emotions, recognize the pain, and recognize the opportunities that your sharing have brought or brings to the table. So thank you so much for all that you and your team members, because no one ever works alone.
No one ever works alone. Yes.
And so I wanted to thank you for that.
Thank you.
Hey, good afternoon again, Ms. Bartlett. I had a question, or rather a statement you made. You said something about zinc. Some people having higher levels than others. Could you explain that a little bit more?
So there's a study that's underway that is showing that zinc may be helpful in reducing the harmful effects that uranium and other heavy metals have on the body. And the reason that they're saying this is because it appears that zinc competes. That was the word I couldn't come up with earlier. Zinc competes with the receptor sites on the cell that the heavy metals are also wanting. So if you fill those if you fill those receptor sites with zinc, instead of the heavy metals, there is less of those receptor sites available. That's the theory. The research is still being done. It's being done by the metals team out of UNM. But I'm looking forward to seeing the full results of that. So I was trying to attribute that to why some of the uranium miners may not have been affected as much as others. And that was just like one of the things that we really don't know, but maybe it was one of the reasons that they weren't as affected as their person standing next to them. Yes.
All right, testing. Okay. So first, thank you. I know this is a huge issue and I have to express gratitude for the work that you're doing.
Thank you.
And your team, as these guys mentioned. But I'm Navajo. I'm from Cameron, as I mentioned
Yes.
earlier. And if you look on the map, we're really close to uranium.
I love Cameron. It's beautiful. I know where it's
Yeah.
at. Yeah.
So this is something I have somewhat been familiar with since youth. And I would like to, I guess, share that I do have some feelings of annoyance that there hasn't been. I mean, I want to first express gratitude for the work that you're doing on this, but also at the same time, another emotion that comes up is annoyance, because it feels like it's been a long time and there hasn't been as much urgency and as much work that could be done on this.
Yes.
At this point, because it's been so many years up till now. But my question is two things. First is, what is currently being done to close close the open mines? And also on top of that, what can we do as people in the audience right now and people watching virtually? What can we do to help push and remedy this issue?
So good questions, and absolutely I understand the frustration. It's a long process and it's gonna keep going for a while. So one of the slides, I always do this, I take out slides I wished I had, and then I put in slides I wished I hadn't. But one of the slides that I took out was actually some of the mines that they have gone in and cleaned up or covered up or somehow protected people from. Some of those mines, what they're doing is they're just shutting the mine down. They're blocking it, like they're putting concrete and boulders and everything in front of it so that mine cannot be accessed. Every mine or every site that they look at doing, and this is Department of Energy, EPA, National, and Navajo Nation. So there's several groups that work together on closing these mines up, but they have to do the studies to see which is the best way to handle each individual mine. Like the one mine at Ruby, that little mom and pop mine I showed you, I did see another picture of it later that it has been closed back over, the soil's been put back over that mine, but they still have a fence around it that lets people know that that was a uranium mine and to avoid it. And it's just a little fence, but it's, you know, it's still a warning. So work is being done, but yeah, I grant it is definitely a slow process. The mines that were releasing the higher amounts of gamma radiation, that 44% on that slide, those mines were the ones that they said were higher risk and that they are working on first. So that's how they've set a priority to those, to which mines they need to look at. They do have workshops or events throughout the year where people can come and discuss their concerns. We had one not too long ago in Kayenta. We did have one in Cameron, probably last year, I think. So I would really encourage, you know, you try to find these, or if you want to give me your information, I can let you know where these events are, and you can come and voice your concerns and see what each of those groups are working on in your area, and see if you can talk to them and maybe get put up a little bit higher on that. But yeah, definitely I can understand that.
Hello.
Hi.
I appreciate your presentation and the work that you're doing. My husband is from Laguna Pueblo, and they also had uranium open mines, you know, back in the day as well. And one of the villages, Pawati, you know, the site has been reclaimed, and, you know, it doesn't look like a natural hill anymore, right?
Right.
We know that it was a mine and that it's covered up. So I don't have a question, but my issues are from an environmental protection standpoint is, you know, we in Region 6, which is Dallas, have to prod, you know, EPA for money to monitor. What are we dealing with? What is that village dealing with in terms of water, you know, and because it's a huge agricultural community. So, you know, just one of those things where from a health standpoint, it's different, but also from an environmental protection standpoint to this day, you know, that we still have to prove to EPA that this is what we need the funding for. And, you know, an environmental justice issue, now that there are all these tic tacs around, maybe this is something that they can help us with for funding to prod EPA or help us with that. But certainly it's still an ongoing issue. Thanks.
Yes, definitely an ongoing issue.
So I'm on Central Time. So maybe I dreamt this. Maybe it was brought up this morning. I was up like at, I don't know, 2 or something, my time. But, or maybe it was 4 my time. I can't really figure out the time. But did I hear on the news this morning someone advocating for using uranium waste as an alternative energy source, saying solar won't do it, wind won't do it? Did I dream this? I can't find it on Google, but this, I said, how appropriate. But that's really all that I remember. Could be jet lag, but is this anything you've heard of?
No, doesn't mean no. It just means I haven't heard it. Okay. There are good uses for radiation, like our fire alarms are used with a form of radiation. So we have medical x-rays.
Hello, thank you for the presentation. Hey, so last week or 2 weeks ago, the Senate apparently expanded the RECA to 2040. It was expired to 2024, about a year from now, less than a year. So will your work continue with this expansion bill that was signed by Senate?
That's interesting. I hadn't heard that it'd been expanded that far. Our work will continue with or without RECA, because the hazards that are with the uranium industry, those people are still there, those health hazards. And so as medical provider, like it's really important to try to get those health outcomes improved the best we can. So both our uranium worker program and our QJIT program for our community members will continue. Yes. But, you know, and I'm very happy about the movie Oppenheimer. Thank goodness it brought new light to the plight of the people that are having problems with the uranium. So
Thank you.
that was good.
Just one quick note. This is just a comment I want to share with everyone. So I live in Tucson. I was raised in Tucson, which is about, of course, you know, about 30 miles west of Shiprock. Further west from Tucson is a place called Narrow Springs. We call it Tucson. At the base, north end of the base of Chusca Range. And so that's where I grew up as a child. Now, there was a mine about 2 miles, maybe a mile and a half at the base of that mountain. I recall our Hogan was built with mining residue of the foundation, as you mentioned earlier. So recently, about 6-7 years ago, I went back to that old home site of ours and I took a picture of it, and the base is still there. The foundation, the rocks that were brought from the mine. And then also my dad used to go to the mine, and the theory and the story at the time, this is probably 69 or 1970, was that those rocks coming from the mine have elements in it that give off heat. So initially they used the river red box, the river rocks from the spring. So they got away from it and started bringing in the rocks from the mine, use them in sweat lodge ceremonies. And so is it any wonder that my dad didn't even see this, 65 years old? So yeah, the impacts is still there. I think it's, you know, I'm glad that you're doing this work and your work will continue.
Yes.
So this is just one of many, many stories across Navajo that families, how they've been impacted by uranium mining. Thank you.
Yes, you're welcome. Yeah, I'm honored to have members of the Navajo Nation share those stories with me.
Any other? I don't want to hold up the time, but thank you so much for your presentation. You know, it's one thing to see all of this stuff come across your desk, talking about uranium and its effects, and it's another to be in a presentation and hear firsthand, you know, what actually happens. I think you answered it, but you were talking about cleanup that was done at a mine. I wanted to know, was that through EPA or is that something Navajo Nation does also?
No, it's through EPA or the Department of Energy are the groups that do most of the cleanup. Yeah, it's not really the responsibility of the Navajo Nation because it was all these other agencies. I'm sure the Navajo Nation would if they could, but it's going to be on their control on a lot of that.
All right, just curious. And the last thing is you were talking about the dust storms that happen.
Yes.
How often does that happen?
It seems like it's getting more frequent over the last, but we typically see it start in the early spring and it just continues until we get moisture. So it's getting, they're pretty common.
Wow.
Yeah.
Thank you.
You're welcome. Are we, any other questions? I know I'm way over on time. And again, I apologize for the slide mix-up. Okay, so I'll be here the rest of today if anybody has any questions. Okay, thank you very much.
I guess since I have the mic, I will pose a question to the group. 10 or 15-minute break. Someone said 30 over here. 15. I hear a couple of 15s back there. Let's go with 15. I don't think a couple of minutes will make much of a difference. So 3:10 then.